I thought cupping was pretty scary because after looking at it online and seeing all the pictures and all the bruise marks that people had after the procedure, I didn't really like it.
Two main different kinds of cupping. There's dry cupping and wet cupping. Dry cupping is probably the more common of the two, and it's used more for therapeutic and relaxation approaches. So the other kind of cupping is called wet cupping, which is kind of like a controlled bleeding kind of thing, and it's used more in curative or treatment options for patients with diseases. And what they do in this kind of cupping is they'll apply suction to the skin for about 3 minutes, and then they'll remove the cup and do little superficial incisions in the skin, and then they'll apply the suction again, and this will sort of draw out some of the blood through little incisions, and that's how they do that.
My name is Kerry Carlos. I'm a licensed acupuncturist here in Redlands, John's cousin. Anyhow, I practice Chinese medicine and acupuncture, cupping, herbs, all that. So I work here out of the Redlands Family Wellness Center. We have a midwife and a couple massage therapists and a Reiki master as well. I'm going to be doing moving cupping. I'm going to work on acute lumbar spasm. But there's also like different kinds of like stagnant cupping. You can bloodlet. You can do different deals with it. Cupping is a method where you create a vacuum in either a glass jar or bamboo cup. We use that for pain. We use it for blood stagnation. We use it for a cold in a meridian or in an area.
Not too much.
If there's a knotted up muscle with no blood going through it, we're just trying to loosen that up and bring blood flow back. This is good to help with diagnosis too. You see different areas that get redder or ball up or whatnot, and it helps you treat. You'd want to do cupping for let's say back pain, neck pain, bronchitis, dysmenorrhea, lots of reasons really. There's a bunch of different ways you can use cupping. So the origins of cupping date back far before, I think, even like written history. We see it in hieroglyphs in Egypt, treating dysmenorrhea, things of that nature. So no one's really sure. Cupping, I wouldn't do constantly, because there is obviously some inflammation caused by it and some, bruising and what. There's like very few contraindications for cupping. Obviously, broken skin, ulcerated skin, rashes, anyone with a high fever. I was looking at kind of what was going on with the back structurally, and after I did that, then you start with one cup, or at least I do, and I do a massage cupping where you have the moving cup going, and you see what changes and what's real tight, and then after that, then I go and I leave them on certain spots that they need to be left on. But I don't just go off the bat stagnant, because I want to use the most effective area. And after that, I'll do some acupuncture, and she'll be good. Good as new. That's that, man. As far as cost goes, obviously it depends on what practitioner you go to, and everyone charges a little bit different. Here at my place, the first treatment is usually $100, which is like an hour and 20 minutes, and after that I charge $50 per half hour or $80 per full hour. But that's ballpark anywhere you go. There's some that are less and some that are more.
After seeing the procedure done at the office, I thought it was pretty cool. Like, I would get it done. It wasn't I would get it done.
Okay, so a lot of the research reviews I looked up from PLOS1.org or the University of Beijing, they all say that although cupping therapy can be really effective for pain or facial paralysis, rheumatic diseases, even like herpes zoster or acne, the problem is a lot of the research done either has like a lot of bias, small sample sizes, or different standards of measuring efficacy. And so the problem is, although there has been a lot of research done, none of it can be definitive because the research was a little subpar.
I mean, I like it. I'm for it.